Hello again, Dr. Jared here from TheraNow, lead physical therapist of TheraNow. I'm here to give you some more tips, this time about creating clarity in virtual care, clarity on your evaluation. So I'll explain. One of the biggest gaps in virtual care is not clinical, it's clarity. Most patients leave the session thinking they understand what's going on, or they have no clue what's going on. They just feel so confused. But even if they do think they know what's going on in reality, they only understand maybe part of it. What typically happens is we explain things quickly using clinical language, even layman's terms, and move forward. We might describe the issue, mention a few terms, and outline what we're going to do next, but we don't always check if the patient truly understands. The current standard assumes that explanation equals understanding. So if I've told you it, then you understand. Or maybe I told you twice. You got to understand at that point. But that's not always the case, especially in the virtual setting. What's wrong with this is when patients don't fully understand their condition, of course, they're less confident, less engaged, less likely to follow through. They really don't see what the point is. I'm going to therapy, saw my first appointment. I don't understand why they're having me do these exercises. I don't get it. Seems like a waste of time. And they're out. People don't commit to what they don't understand. So instead of assuming that the patient understands, we need to build it intentionally. And it comes down to three parts. Number one, explain the process. First, explain the process. Let the patient know what's going to happen in this session and the sessions to come. For example, I'll first get an understanding of your symptoms, do an exam, test your joints and muscles, and then I'll have enough information to uh, work on treatment and things that fix it. Number two is explain the condition. Explain the condition in simple terms. Avoid overusing clinical language. Instead of naming the condition only, explain what's happening in the body. For example, the muscles around your shoulder are not coordinating well and they're weak, which is what's causing the discomfort and the impingement, pinching feeling at the top of the shoulder when you move your arm. Another really good way to explain the condition is get the screen share going, get the YouTube videos going, show them, have them poke on themselves, um, explain it visually, auditory. It's gonna be auditory for the most part, but utilize those resources, diagrams, and wait for the patient might have. Or sometimes I'm an over-explainer. The patient will kind of get bored of what I'm saying, and then I'll know that they know what's going on. Number three is explain the plan of care. Clearly explain the plan. What are we going to do, and how will it help? For example, we'll work on improving movement and strength in your shoulder. Once we strengthen it, that will improve the coordination of the joint, which will stop the impingement, and the tissue will heal over time as long as we stop impinging, and by addressing your movements, your postures, and strength and flexibility in certain areas. So you should see in the next week or two, it's already feeling 10%, 20% better. As long as you do what we talk about, of course. So um, here's a full sample of what something you could say is. Let me walk you through how this looks together. I'll first understand what's going on with you, then assess your movement, and then we'll build a plan. What's happening is, and then you tell them what's going on. What's happening is that your movement pattern is slightly off, which is putting stress on your rotator cuff tendon. So our plan will be to focus on improving that particular movement, raising the arm so that and building strength so that that impingement and that pinch stops occurring. The patient will get a visual, hopefully, they'll get an understanding of why what they're doing in the treatment's going to fix it. They will understand it, therefore be much more likely to be compliant and participate. And good thing is this doesn't take much time, but it makes a huge difference because when patients understand what's happening, they feel confident, more engaged, more in control of their recovery, and that directly improves their outcomes. It definitely will have them coming back to you. Thank you.